Now, last week, two healthcare practitioners came to Morning Live and they claimed that they and other Black and Indian medical care practitioners are being subjected to bullying tactics by medical aid schemes. The two medical practitioners form part of a group of other aggrieved healthcare professionals who say that medical aids refuse to pay them due to the color of their skin. Now, the group claimed that the GEMS medical aid subjects them to unfair audits and is circulating a list with names of Black and Indian healthcare practitioners that are blacklisted. Now, the Council for the Medical Aid Schemes, or CMS, launched a commission of inquiry into these allegations last week. And the Minister of Health, he was here last week on the show and to talk about the allegations of racism. And joining us now is Dr. Guni Goolab, who is the Principal Officer of GEMS. Thanks so much for coming through to answer to these allegations.
Thank you, Sakina, and good morning to your viewers.
Dr. Goolab, so I asked you previously whether you had been following the series of interviews that were conducted here on Morning Live, and you said yes. So essentially, you are being accused of discriminating on racial grounds against healthcare practitioners, Black and Indian in the main, and that you've even gone as far as drawing up a blacklist of practitioners. What's your response to the allegation?
So we want to say right at the outset that GEMS does not discriminate on the basis of race. We do not racially profile, and we absolutely deny these allegations. I want to give the assurance to South Africans that GEMS, in its conduct of its work, we are responsible for 1.8 million lives. We collect contributions on behalf of our members, and we pay claims on a monthly basis on behalf of our members of the order of between 2 to 3 billion rand. We pay this to well over 30,000 healthcare practitioners, providers and facilities, and the vast majority of them get paid without any interruption. We have two ways in which we identify irregular payments. The first is we have a whistleblowing hotline, and about in a year we get between 800 to 1,000 complaints which we then investigate. And then the second way is that retrospectively we look at trends where we see outliers using techniques such as software to identify any outliers. And I can confirm that the healthcare practitioner numbers that we use is from the BHF PCNS number. There is no racial classification there. And on the GEMS database in our systems, there's absolutely no racial classification. So
the group of practitioners that Morning Live had spoken to, the representatives of that group, they were very clear. They specifically stated that GEMS are circulating a list, which they showed us. We went through that list, and it contains the names of Black and Indian medical practitioners. Their names are on it, and apparently you are advising clients not to make use of the services of those people who are named on that list.
So, Sakina, what we do is that after we go through an investigative process, and if we are in line with Section 59 of the Medical Schemes Act, we have the discretion either to pay the member or the healthcare practitioner. And after that investigation, if we come to the conclusion that it's in the interests of our members not to pay directly, which is in a very small number, less than 2%. If we take general practitioners, it's less than 150 of them. What we then do is that we inform our members and the health practitioner that the member can use this health care practitioner. However, they must pay the claim directly, and then the member will, the scheme will reimburse the member.
So what is the impact of that on the medical practitioner? Because what are the chances? Can you guarantee that if you pay over to the member, they will in fact pay the practitioner in return?
So, Sakina, a number of healthcare practitioners, independent of GEMS, choose to expect members to pay them directly. So this is our primary responsibilities to our members. We then have a payment arrangement with healthcare practitioners, and as I indicated to you, over 30,000 of them on a monthly basis, we pay twice a month, regularly and efficiently. And only
but we're talking about the ones that you are not paying. And you say your responsibility is towards your members, so you pay the money over to your members. But are there instances where you have withheld payment from the actual practitioners themselves?
So in the instance where we believe that there have been irregular activity, What we then do is that we do withhold payment and put them on indirect payment.
And is that legally sound? Are you allowed to do that as per the law?
It's Section 59 of the Medical Schemes Act, and there have been a number of judgments in this area, so we believe we're acting fully in line with the Medical Schemes Act. However, we welcome the investigation by the Council for Medical Schemes because this is an area of contention between medical schemes and healthcare providers, and all the stakeholders are part of this process, and we're going to support it fully, and we hope it brings clarity to this process. In fact, earlier this year in February, the Council launched its first Fraud, Waste and Abuse Summit because it's an important issue in our country and in the healthcare area. And GEMS was part of that, and we are signatory to the Charter. And an outcome of that going forward is to develop a code of good practice where everybody can play by the same consistent rules.
So coming back to the issue of this list, so you do have a list of practitioners that you have blacklisted, for lack of a better term.
So, Sakina, we have not blacklisted anybody. As I indicated to you, many medical schemes and administrators, they undertake a process where they do not pay the provider directly. What we do is we inform that practitioner. We also inform our members, and in the interest of protecting our members, they need to know that if they go to a practitioner, they can see them, but they've got to pay upfront.
So what evidence did you gather against these people whose names are on the list for you to arrive at the decision that you have?
So, Sakina, as I indicated to you, there's two ways that we go about it. Firstly, there's a whistleblower hotline process where we receive, for example, a member will say that we send them an SMS that there was a claim paid at a provider, and they indicate that they hadn't visited that practitioner. That's one example. The other is that when we review claims, and we're paying well over 80 million claims in a year, claim lines in a year, so it's a lot of claims. What we then start doing is retrospectively, if we find a significant outlier, for example, that a practitioner is seeing substantially more number of consultations that is physically possible in a month, then we would investigate that, ask for information from the practitioner. If we do not get sufficient evidence of that, so after a significant and long process, only then would we take this action, because for us it's much easier to deal directly with the healthcare
Now,
practitioner.
that was one of the issues, and Minister Aaron Motsoaledi also addressed this issue last week about you as the medical aid schemes asking for personal and confidential information from the healthcare practitioners, which they are under no obligation and in fact have no right to hand over to you. So why would you engage in such unlawful practice?
So, Sakina, again, I want to emphasize that everything that we do is in line with the Medical Schemes Act.
Apparently not.
Well, let me confirm what we do. So, you know, as I indicated to you, we pay, just to give you a sense of the scale that we pay for 5.5 million consultations on an annual basis on behalf of our members, GP consultations, just under 1 million specialist consultations, and 44 million prescription medicines, and about 450,000 admissions.
Respectfully, Dr. Goolab, in the interest of time, I hear all of that, and you are absolutely, I'm sure, au fait with those numbers. However, you do not have the right, as per the acts that govern your profession, to ask for confidential information relating to the patient-doctor confidentiality agreement. So why have you asked that from the practitioners?
No, I think that's a very fair question, Sakina, and let me clarify. What we do is that we pay claims on behalf of our members. We receive the claim, we need to establish whether it's a valid claim. We have upfront permission from our members in order to pay those claims that we can request relevant information to ensure the claim is valid. Let me give you a typical example. In a claim that is submitted to us, we will receive who is the provider and who is the patient, including what they call an ICD-10 code. That would typically give us medical information on their diagnosis. Let's say it's hypertension, and then when the member goes to the pharmacy and get their medication, we receive that information as well. So in the ordinary course of all medical schemes that administrators work, we receive information, and some of it is their medical information in the ordinary course of our work.
But why would you require some medical notes from the practitioners with regard to, confidential information that should stay between them and their patients? Why do you require that?
No, we do not require that, and we do not.
We were told that you actually asked for that.
No,
which is what some of the practitioners then pushed back against, because they upheld that confidentiality.
Yes, now I can give you the absolute assurance from a GEMS point of view that we have the relevant consent from our members upfront, and we only request relevant information in order to ensure that we pay a valid claim on behalf of our members to protect their money and pay for relevant healthcare expenditure.
So with regard to social workers, I'm just trying to touch as many points here as we can. Apparently, you as GEMS, you've cut hours of consultation. Why was that?
So, Sakina, on an annual basis, we develop our benefit schedule, and we, in line with the Medical Schemes Act, we cover day-to-day cover, we cover chronic conditions, which are 26, and then 270 prescribed minimum benefits. And we're always trying to balance the contribution increase and the benefits that we offer our members. And in that process, we review that on an annual basis, and we try and balance.
But what's your review process? Because you talk about having your clients' interest at heart. Did you consult your clients in terms of how that could possibly impact on them?
Yes, so Sakina, as you would imagine, the healthcare needs are almost unlimited. And around the world, healthcare costs are rising. And what we're always trying to do is balance the needs of all of our members versus their contribution increases. And sometimes difficult trade-offs have to be made.
And in wrapping this up, Minister Aaron Motsoaledi, you saw it, he was here, and he was adamant medical aid schemes do not have the right to withhold payment from medical practitioners. They also do not have the authority to blacklist medical practitioners. So, you guilty of that?
No, absolutely not, Sakina. I can give the absolute assurance that GEMS operates within the Medical Schemes Act, and we are regulated by the Council for Medical Schemes. We've been in existence for just under 15 years, and we're proud of our track record of serving our members to provide them quality, affordable care.
But you earlier agreed that you have withheld, in certain instances, payment from medical practitioners.
In line with the Medical Schemes Act, after a process followed in line with Section 59, where we have within that section the ability, where we have found irregularities, to make payment to the member as opposed to the
And you have circulated a list which these practitioners deem you to be blacklisting them as well.
We have not circulated the list. We have made that information available to our members for them to access before they go and visit a
But that's semantics, Dr. Goolab. That's semantics. Whether you have put the list on a website or you have sent it to somebody, you're circulating a list.
And we're doing that in the interest of our members and to protect our members' money.
Well, Dr. Goolab, I'm going to have to ask you to please sit tight. Just sit there. We'll come back to this conversation. And we have to take news now at 8. And then we'll continue this conversation regarding the allegations against GEMS. And they here this morning to defend themselves. We've had a series of interviews in this regard, and GEMS giving us their side of the story this morning. Right now, though, let's take the 8 o'clock.